Okay, wonderful. Thank you so much, Rita. I appreciate it. And as Rita said, I am Tamara Walker. Are you able to see me as well as the presentation? I just want to double check.
Yes.
Okay, all right. Just trying to make sure I've got the settings right.
No worries. Thank
Okay. So I am Tamara Walker. I am a childbirth instructor and a birth doula and a postpartum doula through Birth Boot Camp. And my business is called Mom RN Birth Services. And today we are going to talk about choosing your birth team and why that is so important and how to go about that so that you can have an amazing birth experience, whatever that looks like for you. And so we are going to dive right into this and let me over here. So again, I'm Tamara, and I am a doula and childbirth instructor for the past almost 4 years, and I've absolutely loved what I'm doing. And I am a former nurse, so my business name, Mom RN, comes from I am a mom of two, and now I'm also a grandmother of two. But I'm also a former registered nurse. And so I kind of married the two names together back many years ago when I created a business to help parents with health information and parenting and safety information for their children, and did that for many, many years online. And now a few years ago, decided to dive into birth work because it's something that's always been near and dear to my heart. Over the past 30 years, I've provided labor support for family members, for friends, and it was in an unofficial capacity. I didn't have any formal training in it at the time, but it was just something that because I was a nurse, um, my family and friends came to me asking me for support, and I was able to be in on many, many births over the years, as well as births that I attended during nursing school and as a nurse. Although my specialty in nursing was pediatrics and PICU, not necessarily labor and delivery, but sometimes I was in with labor and delivery. And so birth is always something that's been of interest to me. And I had actually thought one time of becoming a nurse midwife because I had used nurse midwives with my births and had researched that when I was in nursing school. And instead, kind of got led in a different direction of being a doula and childbirth educator because after much consideration and prayer and thinking about it, it really came to me that it's not the medical and clinical side of birth that I'm so passionate about and excited about. It's being able to provide educational support, being able to teach, being able to provide nurturing, caring, encouragement, emotional support, mental support, and providing hands-on physical support for people who are expecting a baby and want to have an amazing birth experience. And so that is something that I really love doing. Like I said, I've been doing that for about 3.5 years now, and I have the great pleasure of serving clients all over the Oklahoma City area and actually throughout Oklahoma. And I also offer virtual support as well online. So again, was a registered nurse, retired from that now. That I truly believe, because of my nursing background, that when it comes to your pregnancy and your birth, you need to look for evidence-based resources and what is the current research and what you learn is so important. And there's a lot of wonderful sources out there. There's also sources that may not be either as up to date or as trustworthy. So you really have to, when you're looking into learning, for your pregnancy and your birth, you really need to, pay attention to those sources. So I do believe that evidence-based education for birth is so important. And when you combine that with doula support, it can transform your birth experience and it can actually save lives. So, very passionate about that. So, it's a little bit about me. And our topic today, like I said before, is a um, important one because choosing your birth team is going to have a tremendous impact on what type of birth experience you have. So, what is a birth team? If you've never really heard that term or aren't sure, what does a birth team consist of? It's people who are going to support you and guide you and give you care during this time of your life, this exciting time that can be thrilling and exciting and joyful. And sometimes it can also be a little bit anxiety provoking, cause some nerves or even fear if you are worried about adding a new baby to your life, or if you're worried about how you're going to handle labor and how that's going to go for you and giving birth. So these people on your birth team are the ones that are going to support you through that, providing medical care. There's going to be medical and healthcare providers as part of your team. And then there's going to be non-medical people on your team, including lay people like family and friends. And these people are going to have a variety of expertise and experience with pregnancy and labor and birth and postpartum. So your birth team is going to consist of people who are going to come together to bring their knowledge and their skills and their care for you to help you have your ideal birth experience. So it's very important to surround yourself with the right people. So, why does your birth team matter? Like I said, these are the people that are going to get you through this and be with you and guide you. And so, if they are experts in the field, if they're medical experts, then you're going to want to make sure that they have the experience and the credentials and the expertise that you desire. And then if you are choosing non-healthcare providers, you're going to want to make sure that they are in alignment with what you're wanting and the way that you're wanting to go through labor and birth and postpartum. And so these people are going to encourage you, they're going to comfort you, support you, and guide you, educate you, and take you through this process. And they're going to share this experience with you. So it's very important because your birth experience is something that you're going to carry with you for the rest of your life. Birth has an impact on us like no other. It is something that, good or bad, it's going to affect us. And we're going to carry that experience forward. And we want to make it the best experience it can be. And so, in order to have your ideal birth experience or to have an amazing birth experience, you need to have the right people on your team. So, when you surround yourself with the right people at this vulnerable time in your life, it can make or break your birth experience. And having the right people is absolutely going to help make your birth experience instead of having a so-so experience or even a bad experience because you didn't have what you needed. So who are the MVPs or most valuable people who should be on your team? What should your team consist of? So when we think of a team, a lot of times we think of sports, right? So our MVPs are our most valuable players, the most important people on the team. Now, when it comes to your pregnancy and birth, you're the star player, right? You are the star of the show. And the other people are going to come around and support you. And these people are going to include either an OBGYN, so an obstetrician slash gynecologist, who is a medical professional, medical doctor for pregnancy and birth, or you may have a midwife instead. And we'll talk a little bit more about midwives in a few minutes. But a midwife is a trained healthcare professional who is a provider for pregnancy and birth. And they may serve not only at a hospital, but they may serve at home births or birth center births, as well as there are some hospitals who do have midwives. And so you may have either an OBGYN or a midwife, or you might even have both, depending on what your needs are and your location, and how they do things. And so these are your medical professionals, your trained healthcare providers who are going to provide those clinical things that you need for your pregnancy. They're going to be checking you for the health of your health, baby's health throughout your pregnancy, and then helping you through the labor and delivery process, giving birth and postpartum. And then another MVP to be on your team would be a doula. And we'll talk a little bit more about doulas in a few minutes. But a doula is someone who offers physical and informational and emotional support throughout your labor and birth process. They may also serve during some of your pregnancy. They may serve postpartum or all throughout. And so this is someone who has training and can provide you with some expertise, as well as comforting you and helping to educate you and help you to advocate for yourself and to know what you need to do. So another person for your team that is an MVP, and I think a crucial part of your team, is a childbirth educator or instructor. And I think you absolutely, absolutely need to take a birth class if you've never been through pregnancy and birth before. And even if you have, then if you're wanting to have a different type of experience than you've had previously, absolutely look into a birth class and consider taking a birth class, because you don't know what you don't know, and it can make all the difference for you. And I've even had, most of my students, I would say, are first-time parents, and they've never been through this before, brand new, and we're going through all of what to expect and how to cope with labor and everything they need to know. However, I have had parents come to me who already have given birth and want to take a class because they want a different experience. And usually that means they want a better experience than what they've had before. And so it's a game changer. Childbirth education is super important. Then another member of your team might be a nurse or nurses. If you're doing a hospital birth, if you're giving birth at a hospital, you're going to have nurses care for you, and they are going to provide medical care for you and support. And they are absolutely essential to that process. And last but not least, your MVPs that are your non-medical professionals are going to be your partner or spouse, and or if you have family members or friends who you want to have with you in your birthing space supporting you. And we will get into a little bit more about choosing who's going to support you in a few minutes. So these are our MVPs. Now, there are other people who can support you, but these are what I consider the most important components of the team after the person actually who's pregnant and giving birth. Because like I said, you're the star of the show. And these are your support people that are surrounding you on your birth team. So let's talk about how we can choose these MVPs, a little bit of guidance on helping you to make the best decisions for yourself and what type of experience you want to have. What is most important to you for your birth experience? Because that's very personal. What you want may not look like what somebody else wants, and that's okay. So finding the right people that align with what you're wanting and needing is so important. So if you are choosing an OBGYN, if you're going to use a doctor for your pregnancy and labor and birth care, you're going to want to first find out who's in network for your insurance. If you have insurance, who's in network, out of network, that might impact your decision. Finances tend to kind of narrow our choices down. You absolutely can go with somebody that's not covered by your insurance if you choose to do so. But many times, if we're starting out looking for someone, we tend to look who's covered by your insurance, who's a network, who accepts our insurance, and then look for what their credentials are and their experience. Are they a brand new doctor fresh out of med school? Is it a doctor that's been at this 30, 40 years or in between? And what are their reviews online? Or I always recommend if you're on Facebook, go onto Facebook, join a mom's group, and ask. Moms are happy to share whether they've had a good experience or a bad experience with their OBGYN and whether they recommend them or not. And I see it almost daily. I see it in the moms groups that I'm in. Somebody will ask for recommendations for an OBGYN. And so get those recommendations, check out their online reviews, check out what their credentials are. And then you also want to find out what is their compatibility with your birth plan. If you know that you want to do a hospital birth, but you want to go unmedicated, you're planning not to have an epidural or use medication, then you want a doctor who is supportive of natural birth or unmedicated birth. If you go to an OBGYN who believes that every single person should have an epidural because that's the way it should be done, that may not be compatible with what you're desiring. And vice versa. You wouldn't want to go to a care provider who was completely against you using medication if you chose to do so or wanted to do so. And so you need to find out what's their compatibility. If you are wanting to do delayed cord clamping when baby's born, you want a provider who is supportive of delayed cord clamping versus a provider who says, nope, as soon as baby's born, we're clamping that cord. Find out their compatibility. And if you're not sure, then it may take, some visits and some communication with them to find out if you're on the same page. And their communication style is important too. You want an OBGYN who listens to you, who answers your questions, who makes you feel supported and cared about, versus a doctor who dismisses your questions or concerns, who rushes you in and out the door, who does not take the time to really find out how you're doing, other than just your vitals and baby's heartbeat and okay, things look good and bye. You want a provider who has a good communication style or bedside manner, who makes you feel like you're being listened to and cared about, and that you're important and not just a number on a chart. So communication style is important. And then also you want to check what the hospital affiliation for that doctor is. And is that hospital or hospitals where that doctor does deliveries, where they have privileges to deliver babies, is that where you want to give birth? If not, then you may need to find a different doctor that delivers where you want to deliver. And so all of these things are important for choosing an OBGYN that's going to be a good fit for you and a good care provider for you. And if anybody has any questions at any time, please feel free to jump in. I cannot see the chat. So Rita, if there's somebody that has questions in the chat, would you please let me know?
I sure will.
I would appreciate it greatly.
No problem.
Wanted to take a minute to say, feel free to jump in with questions. You don't have to wait till the end. We will have a question and answer time at the end, but go ahead and ask if you have them. So if you choose not to use an OBGYN and you are choosing to use a midwife instead, some things to consider when choosing a midwife is there are actually a few different types of midwife. There's not just one training or one kind. There are certified nurse midwives who are actually nurses who have then had additional training and licensing to become a midwife. There are certified professional midwives who have had professional training and certification. There are certified midwives, there's direct entry midwives, and then there's traditional or laid midwives. So it's important to examine what kind of midwife do you want and who's available in your area, because you may be limited in choices. There's a lot fewer midwives, unfortunately, than there are OBGYNs, and especially depending on where you are located. So some areas of the country may have more than others, but take a look at that midwife's credentials, what their training is, what their licensing is, just like when we talked about with the OBGYNs. What's the credentials? What's their experience like? Have they been doing this for a lot of years? Or are they brand new, fresh out of school? And do they fit with what you're wanting, with your birth plan? Just like I talked about with the OBGYN. If you don't have a compatibility with your care provider, that's going to cause issues. And so making sure you're on the same page with your midwife about what you're wanting is important. What is their philosophy of care? Is she a more hands-on care or more hands-off? What does she do? What is her philosophy for the birth experience and how she handles it? What is her style of care? All of those are important. And then the birth setting as well is important because most midwives either deliver in birth centers or at home for home births. Some do contract with hospitals or work in hospitals. However, those are a lot fewer and further between than the ones who are doing birth center and home births. So again, where you're wanting to give birth is going to play a big part into who you choose. If you are wanting a hospital birth, but you're wanting a midwife instead of an OBGYN, then you're going to need to find if you have that available in your area and what that looks like. So choosing a midwife is pretty much very similar to choosing an OBGYN. And the exception for midwives with insurance is a lot of midwives are not covered by insurance. If they are in a hospital and working with a hospital and in a hospital, then insurance may cover. Those who do home births and birth center births, much of the time, they are not covered by a lot of insurance companies. So it's important to know what your insurance covers and doesn't cover, and whether you want to pay out of pocket. For myself personally, I did choose midwives for my births, and they were not covered. I gave birth at a birth center. They weren't covered by my insurance, so we did have to pay more out of pocket. At the end of the day, though, it really ended up versus a hospital birth. And what I've been told by other people more recently is you can make the math work, because hospital births have become so expensive that even though you may be initially paying more out of pocket, it kind of washes out, or it may only be slightly more. And so if that is what you're wanting, if you're wanting a midwife, then look into all of those factors. So choosing a doula. Doulas, like I said, are so incredibly important. And you may be going, what is a doula if you've never heard of one? What does a doula do? The role of a doula is she is not a medical professional, or if she has been, she's not acting in that capacity. Such as, like I said, I'm a retired registered nurse, but when I am doing doula work, I'm not acting as a nurse. I'm not doing any clinical tasks. So a doula is offering physical support through comfort measures, helping mom through labor and delivery. She's offering emotional support and comfort, and she's offering informational support and helping her to advocate for herself and to understand what is going on. A doula is also not just there for the person giving birth, but also for the partner as well, or spouse. And so when I serve, I'm serving the couple. And that may look like hands-on care for my client, coupled with giving emotional support, being that extra person to, oh, they're, you know, mom's been in labor for a while, dad hasn't got to rest and he's exhausted and he needs a break, or he needs a bio break to just go to the bathroom or go grab something to eat. Then I'm staying with her, taking care of her, so he can have the peace of mind to be able to leave for a little while or to sleep for a little bit. um, After there's been times where after baby's born and all the initial golden hour time with baby is over, then parents may be really hungry because maybe it's been hours and hours since they've had a chance to eat. And I've gone and run through the drive-through to get them food and bring it back for them. I'm there to take care of the couple in whatever capacity they need that's not medically related. And it's important when you're choosing a doula to choose someone who is certified, although absolutely there are non-certified, non-professionally trained doulas out there. And I'm not saying that they're not good at what they do. Um, Me personally, I just feel like it's important for somebody to have training and certification that shows that they've been through training. And I did say earlier that I provided labor support for over 30 years for family and friends. I was not trained as a professional doula. I was not charging or presenting myself as a professional doula. And when I did go through the training a few years ago and become certified, I was incredibly amazed at how much I learned and that I did not know before, even after having been supporting many, many births over the years. I learned so much, and it was a wonderful experience, and it helped me to be able to now provide a much better experience and much better support for my clients. So I do think that that's important, to find someone who's trained and certified. I recommend interviewing at least 3 doulas. If you're going to hire a doula, you want to find somebody who clicks with you, that you feel comfortable with. You're inviting this person into a very vulnerable time in your life, and you want somebody whose personality is going to mesh with yours and that is going to enhance your experience and not be a source of stress. So interview at least 3 doulas to find the one that best fits with what you're wanting. And you also, again, want to make sure that the doula you hire has compatibility with what you're wanting, what type of birth you're wanting. You would not want to hire a doula who does not believe that moms should have medication during labor and birth if that's something you're wanting for your labor and birth. Vice versa, if you are wanting an unmedicated birth, then you may not want a doula who only serves clients who have epidurals. Um, so find somebody who's compatible with what you're wanting, and get that way you can choose who's the best one for you and what fits the best for what your needs are. So that's a little bit about doulas and choosing a doula. Why should you consider having a doula? So I get asked this all the time because, especially if a mom is going to be delivering at the hospital, a lot of times they think, well, I'm going to have the nurses there. And so, I'll just do what they tell me. They'll take care of me. I'll have the support that I need. My partner's going to be there. My spouse is going to be there. Why do I need a doula? Why should I even think about that? So again, like I said, doulas play a big role in supporting not only you, but your spouse or partner as well. And in the United States, only about 6 to 10% of expectant mothers use a doula at this time. But in other countries, that number's a lot higher. And there's good reasons for that. With a doula, there has actually been research studies that have shown doula support increases the likelihood of a spontaneous vaginal birth by 15%. It decreases your risk of needing a cesarean section by 39%. And there's a 10% decrease in the use of pain medications for moms who have a doula. And it can make a huge difference. There are researched, evidence-based health outcomes that support doula usage. And there are insurance companies who are now starting to come on board slowly but surely to reimburse for the use of a doula because they are seeing the benefits, not only for you as someone who's pregnant and giving birth, but also if the insurance company doesn't have to pay for pain medication or doesn't have to pay for a C-section, if we were able to avoid one, then that's a financial benefit for them as well. So a lot of insurance companies are starting to reimburse for the use of a doula. Another important factor of doulas is the increased satisfaction that moms experience when using a doula with their birth experience. So having that support, feeling supported and cared for in labor greatly enhances the birth experience. And postpartum benefits as well. Doula support can lead to lower rates of postpartum depression and postpartum anxiety. And that could be because you had a better supported birth experience. It could also be if you hire a postpartum doula, or if your doula that you hired for your birth also does postpartum support, then you're getting that support during postpartum that decreases your risk of postpartum depression and anxiety. And the moms that do develop that tend to, with a doula, recognize that more quickly and get help and treatment more quickly for that and have better outcomes. So doulas are so important, and I really encourage you, if you have the opportunity to look into having a doula for your birth, do so. again, one of your MVPs that I think is super, super important is a birth instructor or childbirth educator. Whether you want to take a birth class that is a group class or a private class or an online class, in-person class, whatever that looks like, there are opportunities available out there. It's a matter of finding what is the right fit for you. There's also a lot of different styles of birth classes and a lot of different so-called methods out there that are available. And so you need to find what is the best fit for you. What resonates with the type of birth experience that you want to have, and what do you want to learn and how do you want to prepare for your birth? So I do recommend when you're looking for a birth instructor, find one that has a class that is evidence-based, or they are providing information to you that is current, researched, evidence-based information. You wouldn't want to go to a class that is teaching things from 30 years ago and they've never updated their info because a lot of things have changed. So find a class that has evidence-based information, certified preferably, so that you know that this person who is teaching you has training and certification to be teaching and that they are not just teaching anecdotally or just only based on their sole experiences, that they're actually giving you factual information. And then again, compatibility with your birth plan. Like I said, find the one that works for what type of birth you're wanting to do. So me personally, I do teach for a company called, with a curriculum through a company called Birth Boot Camp. I'm a certified birth boot camp instructor with evidence-based information. That is why I chose them. I loved that factor, but then I also loved that we're not focusing on a specific method. We are teaching you, here's all of your options. Medicated options, unmedicated options. Here's what to expect in labor. Here's how to cope in labor. Here's comfort measures, relaxation tools, nutritional information, exercise information. How can partners support? What are resources and tools that you can use? A plethora of information. We have classes available for that. So there are, like I said, lots of different birth classes out there. There's a lot of great ones out there, and you need to find what resonates with you and what kind of birth you're wanting to have. So again, why should you consider having a birth instructor or childbirth educator? They can help educate and prepare you by giving you information on the birth process, what to expect in labor, what are your pain management options and techniques, and how to cope with labor, how partners can support you. They are educating and preparing you. They're giving you that confidence and empowerment, because when you have the knowledge, that old saying, knowledge is power. Knowledge can give you confidence and take away that fear and anxiety of the unknown. Because I've known so many people who have gone into labor and birth with a lot of fear and anxiety because they didn't know what to expect. So just having that information can be powerful and help you to make informed decisions and to advocate for what you're wanting and to feel supported. It also leads to improved outcomes, because when you know what to expect and you know how to make informed decisions about your care, then that is going to help you to make the decisions that are right for you and to help you have a better outcome, whichever way your labor plays out. It also offers you community and support, especially if you take a group class, then you get to be surrounded with other people who are going through similar circumstances as you. And a lot of times people end up making good friends with other people in their class. So take a birth class, find an instructor. So another MVP on your team is nurses if you are giving birth in a hospital. Now, when you check into the hospital, if you're having a baby, you may not get to pick your nurse. You're going to have a nurse assigned to you. And then if you're still there and shift change happens, you're going to have a different nurse. You're not getting to hand select your nurse most of the time. However, if that nurse has a bedside manner that just doesn't click with yours or isn't compatible with what you're wanting, you have the right as a patient to request a different nurse. You can ask for the nursing supervisor and you can let her know or him know, I feel like I need a different nurse. Could you please assign a different nurse to me? Or you can have your partner or spouse ask for you. Um, Most of the time, the labor and delivery nurses that I come across and work alongside when I'm supporting a patient or a client at a hospital birth, most of the time they are amazing. They're incredible. And then sometimes you're going to have one who maybe isn't so great. And so you need to know that you have that right if you need to request a different one. But most of the time, you're probably going to end up with a nurse who is fantastic at what she does and makes you feel cared for and supported. So, one thing to understand though, going back to the need for a doula, is that misconception that nurses are going to be with you constantly through your labor once you check into the hospital. And that's just typically not the case because a lot of times they may have other patients to take care of. And so they're going to be in and out, taking care of you, taking care of other patients. They're not going to be able to spend hands on 24/7 supporting you while you're in labor. And some nurses will give hands on comfort measures, hands on support. A lot of times they don't have the time to do that. So they're just not able to. So you're going to get some support, but you're not going to have the support that you would as if you had a doula. And then last but not least, on your birth team, you're going to have your spouse or your partner, if they're going to be present, or maybe a family member or friend, or you may have a combination of people in there. And they are there to support you, encourage you, comfort you, take care of you during labor. But it is so important to be selective of who you allow into your birthing space, even if they're family, because ideally you want them to be supportive of you and supportive of your birth plan. And you want somebody who's going to calm you and help you relax versus somebody who's going to stress you out and make you feel like, you know, labor's even more difficult just because this person is causing me anxiety and stress or frustrating me or bothering me. It makes all the difference. And so in my classes, I tell people all the time, just because somebody is family does not mean that you have to allow them in. You should not feel guilty if you choose not to have your mom in with you, or your mother-in-law, or your sister, or your cousin, or your friend, or whoever. It should be your choice of who is going to be in that vulnerable space with you. Because for each additional person in your birthing space, there's the potential for that to increase labor time, make your labor even longer, especially if they are causing you stress. If they are not calming and relaxing you, then they could end up causing your labor to go longer. And they're going to cause you to not have the birth experience that you're wanting, or at least not as ideal and feeling as supported as you want. So letting somebody into your birth space is a very personal choice. And I know a lot of women struggle with, well, if my mom really wants to be there, or my mother-in-law really wants to be there, but I'm not sure I want her there. And then they feel guilty if they say no. It's not their body, it's not their choice. This is your experience, not theirs. You have the right. So you can decide who to have around you. And if you let somebody into your labor space and say you're, for example, if you're having a hospital birth and you let a family member in, and you thought it was going to be okay, but then they start kind of stressing you out, but maybe you don't want to be the one to say, I need you to leave because you don't want to hurt their feelings or you don't want to feel confrontational or you're too busy focusing on your labor. You can have your nurse ask them to leave. And nurses tend to be really great about doing that very tactfully, um, or being very direct if they have to be. If you have a doula, you can ask your doula to help you with getting that person to leave. And so, what that could look like is maybe I find a job for this family member to go do. Oh, maybe they are going to need some food for later. Could you maybe go get them some food? Or, find some way that's very tactful that gives them something to do so they feel like they're helping. Because most of the time, they're wanting to feel like they're helping you. And giving them a job to do that gets them out of the room can be helpful. So, again, make sure that whoever you're surrounding yourself with is going to be beneficial for your actual birth experience. Um, I had personally, with my oldest child, I was giving birth at a birthing center, and my mom showed up while I was in labor, and my in-laws came, but they stayed out in the kind of waiting room area, and I've seen them occasionally, but they weren't like staying in the room constantly with me. Um, I had thought about asking my mom to be in for the actual birth. But seeing that she was so incredibly nervous and anxious and stressed out and freaking out while I was in labor, I decided that was not going to be beneficial for either of us. And so I chose not to invite her in for the actual birth. Her She told me later on down the road that she was actually relieved because she just didn't feel like she could handle it. And this woman had 5 children, so I thought, oh, she can handle this. But it's completely different when they're seeing their baby in labor and giving birth. And so she just was stressing me out. So I had to ask her not to be in there. So you have that right. It's your birth, your experience. Don't let anybody guilt you into thinking you have to let them in. So additional support members on your birth team might look like a lactation consultant if you are planning to breastfeed. And so if you are using if you're having a hospital birth, most hospitals do have lactation consultants on staff. And if they do, take advantage of that while you are in the hospital. I always tell my students and my clients, even if breastfeeding starts off seeming like it's going great, while you are still in the hospital, have the lactation consultant come by and get their expertise, get their help, ask your questions because they're surely going to have some. Um, Take advantage of them being available to you. And a lot of times, those lactation consultants are available for consults up to a year after baby's born. There are also independent lactation consultants and internationally board certified lactation consultants that you can find in your area should you need a home visit. Say you are home with your newborn baby and maybe an issue arises and you need expert help. There are a lot of lactation consultants that do home visits, and come to you, so you don't even have to get out and go to an office or go up to the hospital. You also need to have a pediatrician or a family doctor for your newborn baby. So they're going to be a support member of your team. And a lot of times, parents are choosing this provider while they're still pregnant. You can go for a consultation or an interview appointment if you're considering a pediatrician. And while you're still pregnant, and then get that set up so that you already have your pediatrician chosen when baby's born. And if you don't have a doctor chosen for your baby by the time baby's born, then typically, if you're doing a hospital birth, they will have the hospitalist for the pediatric department see baby while you're still in the hospital. And then once you're discharged, you can hire a doctor for your baby. If you're doing a midwife birth, birth center, or home birth, a lot of times those midwives can see baby for those first few weeks or even few months. And so, depending on the midwife and what their services they offer for after baby's born, that could be an option that they may take care of baby for a short time after baby's born, while you're looking for a healthcare provider for baby. You also want to have on your team postpartum support. So that may look like a postpartum doula who serves after baby is born, not only taking care of baby, but primarily focuses taking care of mom and mom's recovery. And that may look like assisting with taking care of the baby. Sometimes it looks like providing some nourishing meals, coming in and doing some light housekeeping, or taking care of baby while mom naps, or if it's an overnight doula while parents sleep, postpartum doula is taking care of baby, either giving baby bottles at night or bringing baby to mom when baby's needing to be fed. But taking some of those duties off of the parent's shoulders for a little while. You also may need some mental health support during postpartum, and there are some great postpartum support groups available. There's Postpartum Support International.org is a great website that can show you what resources are available, and also give you resources in your area if you're needing to connect with a mental health professional for postpartum support. Other providers on your team could include a pelvic floor therapist, and some people choose to see a pelvic floor therapist while they're still pregnant before they give birth to prepare for labor and delivery and for postpartum. Others may go to a pelvic floor therapist after they give birth, and that can really help with preventing issues or to correct issues with pelvic floor, because pregnancy and labor and birth are, hard on the pelvic floor. And so they can help with issues such as any bladder leakage or incontinence, any prolapse of organs, or discomfort. Pelvic floor therapist can be great for helping you get back into an exercise routine that's safe for you postpartum. Lots of different benefits. And then a chiropractor can be somebody that you see during pregnancy and postpartum. And seeing a chiropractor who is Webster certified, meaning they have additional training for pregnancy, they can really help to get your body into alignment, to give baby the space baby needs, to get into proper alignment for labor and birth. And so that can make the process of labor and birth easier, is when your body has been adjusted and is in alignment, because if there's anything that's off, that can impact baby's ability to get in proper positioning, which can affect your labor. So for example, my first baby, I have a history of hip and back issues. I have a congenital birth defect that also impacted my hips. And so I had never seen a chiropractor back when I was younger and did not understand the dynamic of, even though I was a nurse, I'd been through nursing school. I did not have that additional knowledge to know that because of my hip and back issues, that was going to have a big impact on my labor. And so my first baby ended up being what we call OP, occiput posterior, meaning they was a stargazer or sunny side up. Baby was born face up. It made my labor take a lot longer and pushing take longer. It was, I had a lot of back labor. And overall, I truly believe if I had gone to a chiropractor back then, especially while I was pregnant, I might have been able to have an easier labor, and baby may have had, my son may have been able to have the room needed to get into proper alignment. And so I think it would have been an easier experience for both of us had I had that care. So I recommend looking into that. So making your decisions about your birth team, again, you want to do your research, you want to do interviews, trust your instincts about this person or people. How do they make you feel? Do they make you feel comfortable and supported and cared about, listened to, heard, or do they cut you off, not answer questions, rush you, or do their views not align with yours and what you're wanting? Create a birth plan and make sure that you're on the same page, that you're all on the same page and that you've discussed it and that you have a cohesive team. And then having flexibility and open communication so that you're all in it together to support the best outcome is important. Additional factors to consider is your location and what options are available to you. Or if an option that you really truly want is not available in your area, are you willing and able and have the means to travel? Is that a possibility? Or do you need to change and be flexible with what you're wanting? What does your insurance cover? We kind of already talked about that. And what your insurance doesn't cover, there may be additional ways to fund what you're wanting. And so you might look at whether your insurance reimburses what you're wanting or not, and whether you have a flexible spending account or a health savings account. Some of those will reimburse things such as childbirth education, a doula, lactation consultant, different things that may or may not be covered by your health insurance itself. You can also create a baby gift registry, which has a fund to help you fund for a doula or birth classes or whatever you're wanting for your team that may not be covered by your insurance. So having the best benefit or having benefits for the best birth team, again, continuous support, reduced anxiety, increased comfort, improved birth outcomes, and decreasing that risk for postpartum depression or anxiety. So it's question and answer time. I know we're kind of running close to two for you. Do you have any questions that I can help answer?
If you do, you have two options. You can either put it in the chat or you can unmute your mic and you can ask Tamara your question. Don't be
Do
shy.
we have any questions in the chat?
No questions as of
Nope.
now, not in the chat.
Okay. All right.
Oh, we do have one. Oh, she said, thank you for the information. Thank you. Thank you for coming.
Thank you. Yes. Thank you for attending.
Yes.
Okay. So if there's, pardon?
No, go ahead.
Okay. Well, if there are no questions, then I would love to invite you to connect with me So my website is MomRN Birth Services. I've got the link here and a QR code if you want to scan that to take you to my website, or connect with me on Facebook. And I also am a partner with Mommy Care Kits. Absolutely love them and recommend them to my students and clients. And so that's another great, not necessarily a person on your birth team, but certainly tools that can help you for your pregnancy and birth and postpartum. So my link is there for Mommy Care Kits. And I would love to hear from you. If you think of questions later, please feel free to reach out and contact me. I'd be happy to answer. And I appreciate your time today. Thank you for joining me and allowing me to share this information with you.